Hey y'all, it is 4:05. We're going to go ahead and get started with this webinar. As you see on the screen, and actually let me get a thumbs up. Can y'all see the screen? It should say welcome and a few things. Okay, thanks for the thumbs up, y'all. It's very helpful. Okay, so just so you know, this session is going to be recorded. If you're not comfortable with that, please make sure you're off mute or on mute. Make sure you're on mute and your camera is off, but we will be recording this webinar and it will be posted on our YouTube. So it's just a warning if you need to jump off. We're going to talk a little bit about the Health Equity Fund today, and this will be a short presentation. We'll reserve some time at the end for questions. So as you might notice, everyone is on mute throughout the duration of the presentation, and then we'll stop recording at the end and you'll be able to ask any questions you might have. But yeah, I'm going to go ahead and get started. Welcome. And first, thank you so much for your interest in applying for the Health Equity Fund. My name is Delaney. I'm our interim managing director here at RHPHF, and I'm really excited to talk to y'all today about the application. Okay. So RHPHF is a 501c3, and for the next hour, we're going to learn more about the background and the management of the Health Equity Fund and all the investments we've made since its inception and what the 2026 funding cycle will look like, including details about the application, grant writing, the selection process, and ongoing reporting requirements. We'll save about 20 minutes at the end for questions. During which time you can feel free to ask whatever you need to ask. Okay, so the Richmond Health Equity Fund is the first program for RHPHF, which is Richmond and Henrico Public Health Foundation. And we founded the Health Equity Fund with the support of Richmond City Council through an initial investment of $5 million through the American Rescue Plan Act. So that's the ARPA plan. It's a federal funding source that was in response to COVID-19. Since then, the HEF has built on ARPA funds to create new public-private partnerships and local philanthropic organizations, corporate partners, individual gifts, and of course, sustaining funds from the city of Richmond through non-departmental funding. So it's a mixed funding pool. HEF is locally led and dedicated to investing in gap-filling health services and social supports critically needed in our communities to challenge historic inequities and strengthen health outcomes. Interestingly, the Richmond Health Equity Fund is the first of its kind in the Commonwealth of Virginia and the third in the country. After the City of Boulder Health Equity Fund was established in Boulder, Colorado, and the Center for Health Equity was established in Louisville, Kentucky, the Health Equity Fund was established. So we're the third in the country, which I think is really exciting. As I mentioned a little bit before, the main source of funding for us was originally the American Rescue Plan Act, which is funding through federal legislation that allocated relief money to address the continued impact of COVID-19 on the economy, public health, state and local governments, and more. Richmond City received about $150 million from the ARPA Plan Act for a variety of initiatives, and you may have heard of some different initiatives that are funded by ARPA, but it included funding for an affordable housing trust, programming for youth, investments in recreational facilities, and the Health Equity Fund, among many, many others. And what happened was in 2021, Richmond City Council voted to establish the Health Equity Fund through the foundation and allocate $5 million of the $150 million to RHPHF. It's a little bit about how we got started. So how does the HEF work? There are 3 different entities involved in the management and implementation of the Health Equity Fund who all work together in the funding process. So we have Richmond and Henrico Health Districts, the Community Advisory Committee, and the Richmond and Henrico Public Health Foundation. RHHD, which is the health districts, serve as the chief health strategist and the liaison to the city of Richmond. The health district staff also provides programmatic support and technical assistance for monitoring and evaluation of the applications. The Community Advisory Committee is a key part of our structure, and those folks are community members who use their lived and professional expertise in health disparities to prioritize projects for funding and determine investments. We're really proud of that part of our model. Of the over 180 applications that we've received over the past several years, the CAC has reviewed all of them and has made all of the final funding decisions for the projects that have been funding. So this project is really by the community, for the community, and the community is the folks that are making the decisions. It's really what makes us unique and understand that our funding decisions are informed by real needs of the community that we serve. Lastly, the foundation is a nonprofit arm of the health districts, and I will be facilitating the health processes. So we are removed from the decision making, but we do facilitate the whole process. The foundation is governed by our board of directors, and they approve new investments. They identify additional funding sources through strategic planning and lead the overall direction of HEF moving forward. So what is the goal of the Health Equity Fund? The goal of HEF is to decrease health inequities through in Richmond City and make measurable improvements in health outcomes through investments in community-rooted, gap-filling, and evidence-based initiatives. And we deeply understand that Richmond residents and Henrico residents and those in the broader region face many of the same health challenges and systemic injustice, but the funding that makes HEF possible has been specifically allocated to Richmond and cannot fund projects in Henrico at this time. So that's just an early FYI, is that this is for Richmond projects only. Therefore, activities eligible for HEF funding must be focused on a service or program for delivery in Richmond for Richmond residents only. Here are a few specific eligibility requirements to determine if your program meets the Richmond eligibility criteria. So you should have families served or have residency in the city of Richmond. If you were to measure the impact of your efforts or initiatives, the change in health outcomes would be reflected in measures for the city of Richmond. If your program is based in Richmond City and specifically designed for the nature of an individual/family's transient status, such as release from incarceration or housing insecurity, it is okay if your organization that is looking to apply is doing regional programming. You just won't be able to use funding above and beyond circumstances. The funding will be reserved for Richmond residents. And if you're using funding to pay for personnel or other resources that could benefit more than Richmond residents, you can document an appropriate percentage of that expenditure to correspond with the amount of time the employee or resources services Richmond residents versus other individuals. All right. So the HEF exists to address longstanding health disparities and disinvestment in communities of color, with an emphasis on 5 focus areas that are of deep concerns to residents in those communities. We do have some flexibility for emergent disparities and may focus on that if a particular program is very strong. But in general, we reserve our funding for programs that address access to healthcare and health education, chronic disease and underlying health conditions, food access and security, maternal and child health, and mental and behavioral health. Okay, so a little bit more about HEF investments. So since its inception, the HEF has awarded about $500,000 to $1 million per year in community-based projects. In 2022 is when we began, and we've had funding investments every year since. And as you can imagine, the size of the HEF investments vary. This varies based on the funding we receive and the scope and the potential impacts of projects submitted. Ultimately, when you're creating your application for your project, there's no set minimum or maximum for the project budget. However, the average award size to date has been $85,000, with our smallest investment being $10,000 and our largest being $150,000. I will say this year's funding pool is a bit smaller than we usually have. Whoops, sorry. So we will likely be funding 1 to 2 programs per focus area, so you know. This year, we're also offering $10,000 mini grants for projects specifically during the July 15th to December 15th timeline. So these would be 6-month projects at a strict budget of $10,000. So if you're interested, there is an option to indicate that in the application. Yeah, so this is a little bit about health investment amounts. And to date, we're really excited to say that we've invested over $4 million into 37 different community-based organizations across the health disparity focus areas. The impact has been fantastic, and we have very, very many wonderful partners who have previously or are currently in a HEF project. We're really proud of them. And these are some of our HEF partners, so previously funded partners. Some of y'all may see your organization on this. I know there's a few folks who are back for more. So we've highlighted here all of our HEF partners, and you're more than welcome to check out our website. There's a full list of all of our funded partners from the past, and they've all been wonderful. Very proud of them. Okay, so as you know, the HEF cycle is now open. Excuse me. And we began, accepting applications on March 17th, and we will close the application on April 17th. Please be aware that there will be no extensions past April 17th at 11:59 p.m. Please plan accordingly. If you need to reach out to any of our staff members, you can certainly do so, but we do have that hard deadline. There will be no extensions. Okay, so this is a screenshot from our website. If you haven't checked it out already, please do. And we encourage any single organization or collaborative serving Richmond City residents across our health disparity focus areas to apply before April 17th, including folks who approach their work through a racial equity lens, demonstrate fiscal stability and sound fiscal management, and you will need to maintain general liability insurance of at least $1 million and have staff and board leadership that reflects communities that you serve and demonstrate a strong history of community engagement, as shown through things like community advisory boards, community listening sessions, or community representation on the board, and other similar measures. So we really want to see organizations, again, by the community and for the community. Also, for organizations that have previously received funding from HEF, you are eligible to submit an application for new scopes of work. And new scopes of work, if you are currently meeting reporting requirements as specified in the grant agreement. So for everyone's knowledge, we do have a renewal limit of 1. So if you are a previous HEF recipient, you will need to apply for a new scope of work, unless you were invited to submit a renewal. Please check out our website. Of course, there's our FAQs are on the website, as well as there will be information on any amendments to the application. We don't anticipate that, but everything will be posted on our website. And you can also feel more than free to reach out to our Health Equity Fund email address if you have more questions. Okay, so just a few tips for everyone before we wrap up. For HEF, these are just a few grant writing tips as you work through applying. Make sure you know your audience, so familiarize yourself with our mission. You can go ahead and take a look at the different organizations that we funded, our board, and information about RHPHF on our website. Of course, read the instructions carefully. Make sure you complete all of aspects of the application and read those questions. Make sure all aspects are addressed. Also, especially for programs that are more technical, make sure you avoid jargon. We do have public health professionals that are reviewing these applications, but we also have community members reviewing these applications and making those funding decisions. So you want to make sure any audience can understand what you're saying in your application. Of course, be specific. We love data, and if you have, different things about your program that really show that racial equity lens, or your effectiveness in the community, your community integration of community voice, be specific about that. Really be concrete about the details, about who you serve and expected outcomes. And then, of course, proofread. It's always a good idea to have someone unfamiliar with your work review your application. That's a good indicator on if anyone is able to read it and understand your proposal. So these are just a few tips. And then, of course, just telling your story effectively. So a lot of the HEF application is a narrative-based application. We would really like to see, leading with the why, telling us what your program does, why the community needs this program. If you have testimonials from community members or staff members, those are always welcome. and showing your expertise. So we are looking for organizations that demonstrate public health best practices. So demonstrate that your organization is connected to the community, and how this program will be effective in addressing health disparities. And then, of course, just balancing emotion and data. So storytelling goes a long way, but so do relevant statistics to make your case stronger. And then really what makes your approach unique. We have every year, we have lots and lots of wonderful applications. And you really want to emphasize something memorable about your program, what really makes you effective, what really makes you unique. Okay. For the evaluation plan, you will be asked to select one focus area. So out of our 5, you'll be asked to select a focus area, and those who have completed most of the application or are halfway through the application, this will probably look very familiar to you. You'll select a focus area, and then we have HEF outcomes and indicators on our website and linked within the application. And this is used for all of our HEF programming to make sure we're making progress towards addressing health disparities. So you'll select some of those indicators and create targets for them. Throughout the process, we'd like you to think about how your intervention or proposed scope of work will support the HEF and measurable improvements. So a little bit more on this on the next slide. So we have these outcomes and indicators, which I'm happy to show you all at the end. That list, again, it is linked in the application. The first thing that you would need to think about is what specific changes will occur as a result of your work. So for example, clients have an increased awareness of their own health. And that could be reflected in an outcome such as increase the number of residents that have access to colorectal screenings by December 2025. Identifying measurable indicators. So on our outcomes and indicators list, you will see a list of the outcomes and their associated options for indicators. And those are how you know that you succeeded. So for example, that could be number of individuals screened, and that could be reflected through an indicator such as number of testing kits distributed to clients, for example, 500. The return rate for testing kits could be 50%. And then step 5, outlining realistic data collection methods. So we will be asking you to identify these outcomes and indicators, and also your target for those outcomes and indicators. And lastly, how are you going to track these outcomes? So this is a part of our reporting requirements, is to do these outcomes and indicators. And we'd like to see as well, like, what is your plan for tracking? We'd really like to see you consider your capacity and existing systems that you have in this, and have a thorough data collection plan. For example, that data collection plan could be sign-in sheets or other tracking tools. Maybe you have a standing clinical tracker, something of the sort, and feel free to ask any questions about this at the end, of course. Okay, so just a little bit more about what happens after the deadline. So following the application deadline, the CAC is going to be deliberating between April and June to set priorities for funding and make selections to present to our board for formal approval. So based on your application responses, the CAC will select organizations that work in the most impacted Richmond communities and demonstrate a commitment to racial and health equity, cultural humility and curiosity, community leadership and input, and understanding of root causes. They'll also look for organizations who are aligned with the overall Health Equity Fund program goals, who have and folks that have a readiness to track outcomes and have a unique funding need that is unmet by other sources. During the CAC's deliberation, applicants might be contacted for clarifying questions. So do look out for emails from us about any clarity we might need. And that will occur again during April and June. Okay. By June, we are anticipating final decisions for funding that will occur in late June. There is a possibility of very early July, but we do anticipate late June for our funding decisions being communicated. Our program is a little unique. So after June, once the award notifications go out, new partners will enter the contracting stage, which typically takes 3 to 4 weeks and up to a few months, depending on your scope of work and how ready the organization is to detail the activities that you're proposing. Contracts will outline the activities being funded, projected outcomes and indicators for each activity, and a new detailed spend plan for the award. We also assist partners in co-developing these contracts, and staff works with funded organization to review program details, financial matters, and contract reporting requirements. So we'll be working with you to set up the project. So it's all good to go. And then lastly, after the contract is executed and an invoice for payment is received, we'll disperse the funds. That just depends on when the contract development is done. It could happen late summer into early fall. And that's when the projects can start. So the funding period for this award will begin as early as July 1st. And we ask you to please indicate any impactful start and end dates for your proposed programming, especially if it's not in July, and ensure that your budget plan aligns with the projected timeline. So, oh, I'm sorry, this is a bit cut off. I'm not sure why, but yeah, our default is a year-long project. So we're anticipating projects through this funding would likely be July of 2026 through June of 27, or something very similar, like August to July is also a possibility. And then for our mini grants, which, apologies again, this is a little bit cut off. Our mini grants would specifically have a July of 2026 to December of 2026 project period. And then lastly, the last thing we'll go over is reporting requirements. So because of the requirements that we receive for that fund these grants, HEF partners have ongoing reporting requirements throughout their project period. Quarterly reporting is requested for updates comparing budget to actual spending received, as well as the status of the project and progress towards completion. So they're very simple, quick check-ins about the progress of your project. And then we do require an annual report, including project elements and progress made towards health outcomes. Some of these reporting requirements will include demographics of residents served, including age, race, ethnicity, gender, household income, and physical address or zip code, and also a bit of narrative reporting as well. So when you submit for HEF project, please do be prepared to have some data collection plans in place, including for demographic data. We also talk about outcomes and indicator metrics during those annual reports, and what you will choose prior to finalizing your funding scope. So annual reports are due every year throughout your project term, and no personal or identifying information needs to be submitted through your organization. Even if you choose to collect it, this will all be in aggregate data form. So that is pretty much that. We're about to move into questions, and I'm going to stop recording. And the last thing I would like to point out is if you have any questions or concerns, if you want to chat separately from this webinar, you can email hef@rhphf.org.